Repetitive Nerve Stimulation (RNS). Introduction of the test. A repetitive nerve stimulation (RNS) test is the most commonly used clinical neurophysiology test of neuromuscular transmission. RNS is relatively simple in concept, but in practice, it takes great attention to detail to avoid artifacts that can lead to erroneous or misleading conclusions. Here we will discuss about technique and clinical role of RNS testing, the way in which compound muscle action potential (CMAPs) change in response to nerve stimulation and activation form the basis of an RNS test. The CMAP size may increase during high-frequency nerve stimulation or after voluntary activation. Disease or symptom that suitable for the test. Repetitive nerve stimulation is used to diagnose neuromuscular junction (NMJ) disorders, the most common of which is myasthenia gravis. A decremental response, a smaller and smaller muscle response with each repetitive stimulus is abnormal and indicates NMJ dysfunction. This can be further confirmed if the response normalizes after administration of androponium or neostigmine. Risk toward patients that take the test. First, the test is non-invasive. Although the electrical shock might be uncomfortable for the patient. The patient who have a permanent pacemaker or other implanted simulator in their body must inform the examiner ahead of time before the test. Pacemaker and implanted cardiac defibrillator (ICDs) are becoming more common in clinical practice, and there is no evidence that doing routine electrodiagnostic testing on patients who have this device pose a risk. However, there is a theoretical risk that electrical impulse from nerve conduction study (NCS) will be misinterpreted by device, resulting in unintentional inhibition of triggering of output or device reprogramming. Then, the closer the stimulation location is to the pacemaker and pacing leads, the more likely it is to induce a voltage large enough to inhibit the pacemaker. Despite these concerns, there have been no report of acute or delayed side effect from conventional NCS. There are no known risks associated with administering neither EMG or NCS on pregnant individuals. Furthermore, there have been no documented problems from this operation in the literature. When performed during pregnancy, evoked potential testing has also not been reported to cause any issues or injury. The suitable electrode and gel for RNS test. First, we have Nupret Skim Prep Gel. Second, disposable for this electrode set with lid. Number 3, disposable ground plate electrode with lid. The procedure of the test. Before the test, there is no need to fast. Do not apply any cream, oil, lotion or moisturizer on your body. Wear loose-fitting clothes to allow easy examination of your hands and legs. If you are on anticholinesterase medication, check with your doctor if you can take them on the day of the test. During the test, a neurophysiology technologist will place some electrodes, that is metal displays, on your skin. Next, you may experience some discomfort when the electric current passes through your nerve. The The study is generally performed before and after brief exercise or facilitation of the muscle. Multiple response will be recorded, and the procedure will take about 30 minutes. Result of the test. Abdominal decrements during 3 Hz LRS on more than one facial muscle were noted in the 3 patients, 30% in 2 patients, cases 2 and 7. In both the OO and NA, and in one case 9 in the OO, the borderline decrements 9.7% during 5 Hz LRS were recorded in the NA in one other patient, that was case 10. None of the patients show any abdominal decrements in the limb muscle. Thanks for watching.